Welcome everybody back to another episode of the Parmenius podcast with Bernard Wills and Jordan Shepard, where we talk about all things humanities and the intersections with other fields like sociology, philosophy, the arts, and today's psychology. So today we're going to be discussing mental health in the age of the internet with our guest Veronica Hutchings, registered psychologist here at Counselling and Psychological Services at Grenfell Campus and associate professor. Thanks for being on today.
Thanks so much.
Yeah. Happy to have you. So before we get into today's subject, maybe you can tell us a little bit about your background, your work.
Sure. So my PhD is in clinical psychology, so technically I'm Dr. Hutchings, but I tell everybody that I like my name, so please call me Veronica. I actually came to psychology in a bit of an interesting way. It was out of my interest in aging and volunteering in a long-term care facility here in Corner Brook. Became fascinated with dementia. That led me into the field of health psychology, which is really, how do people, navigate and cope with psychological symptoms when their bodies are breaking down and not doing the things that they're supposed to be doing. More recently, though, since moving back to Corner Brook and accepting this position here at Grenfell almost a decade ago now, my interests have really shifted towards working with younger adults, particularly those in the university age range, and particularly looking at healthcare in rural areas, so rural, remote, northern spaces. There's a lot of healthcare stuff that tends to be urban focused because that's where the bigger hospitals are, that's where the specialists tend to congregate, and so sometimes you have to make changes about that. So that's kind of where a lot of my research interests lie right now, is more in kind of that mental health, particularly in rural spaces.
That's cool. I saw one of your papers online that said there's a kind of a two-tier system here.
Yes, it's quite challenging when we're looking at mental health in particular. There, even though we say in Canada that it is publicly funded, the number of psychologists, the number of mental health professionals, particularly right now in Newfoundland and Labrador, there is a gross discrepancy between the resources and the demand. And so as a result, those individuals who are able to afford to pay for individuals privately, they can often get the service, versus those who are having to rely on the public system. There can be quite lengthy wait times, and in some cases they're not able to get the resources, particularly if you're looking at individuals who are living in smaller rural spaces. A lot of times people think telepsychology is the answer or telehealth is the answer, but there are places in Newfoundland and Labrador that don't have reliable high-speed internet, just because the infrastructure isn't there, and that's that's just a reality of our situation.
Okay. So I guess we should just launch into the main topic, which I suppose is a very contentious one, and that is the particular effect of social media, Facebook, X, TikTok, all of this, Instagram, right? On the mental health challenges facing, I suppose, the students you deal with. And also, of course, younger people in junior high, high school, and so on. Because like many of us here, you're a parent at the same time as you're a therapist.
I am indeed.
Of two pretty close in age generations.
Yep.
Okay.
Yep.
Right.
It's really interesting, when we look at what social media is doing, and there's very clear research kind of looking at the association between increased use of social media and higher rates of anxiety, higher rates of depression, decreased sleep or just more disturbed sleep. So maybe it is you're getting the same amount, but it's more broken up.
Yeah.
Do you know what I mean?
Yeah.
We're also seeing the impacts in terms of our perceptions being skewed. So, for example, individuals, nowadays, years ago, kind of when I was growing up, there was magazines and people were airbrushed and filtered. But now, anybody, when you're posting a picture, there's filters, you can whiten your teeth, you can, get rid of your pimple, like all sorts of things quite easily. So it's really skewing those perceptions, so which can in turn have an impact on one's mental health, right?
Yeah.
Because the examples aren't real in terms of what they're looking at.
So the first question I would ask about this is, since there's a good deal of controversy over the matter, do we have solid numbers that back up this association in terms of, is there an established body of data, right, that conclusively, or at least creates a very strong impression that increased levels of anxiety and depression and other things we're seeing are rooted in social media use?
So there is definitely, yes, in terms of the numbers. I don't actually have them off the top of my
Okay,
head.
you don't.
Right?
Okay,
right.
That's not necessary.
We do have. There is clear data there, but with a lot of things in psychology, sometimes it's really hard to do those really clear experiments. For example, we can't just section off a group of people and say, okay, you're not going to have any exposure to the internet and social media, and these guys are, and then we're going to see what happens.
So you can't
right?
set up a control group, basically.
Not really, right? Like, not in terms of long-term kind of every aspect of their life. Can we do smaller scale examples where, we're limiting people's exposure to social media? Yes. So, and that's where a lot of some of the data is coming from in terms of those types of studies. Right? But even just anecdotally, I mean, and this is one of the challenges when we're looking at, any psychological and almost really any health phenomenon, it is so individual, right? So something that is really good for somebody might be quite detrimental for somebody else, right? So when you're thinking about, like, for example, use of screens, right? For somebody who has, for example, developmental disability, if they're using, that tablet might have specialized programs for them to be able to use, which could be actually an accommodation, kind of assistive, help them out, versus for other people who are using these and playing these games, it's kind of like, no, this is not actually doing anything beneficial for you, you're just wasting or spending time on them. Yeah. Right?
Okay. So in a certain sense, it's a bit like cannabis use.
It's very individualized. And this is, prior to coming here, I spent 10 years working in public health care in Halifax. And one of the things, the biggest thing I think that I took away from that time is that the practice of medicine, even though everyone says it's a science of medicine, there truly is the art. Like when we're talking about the actual practice in terms of what is in best interest of this patient in front of me, it's an art. You got to really try to figure out what works best. And I think the same is true of social media. Right? In terms of how is this affecting you, right? How is this affecting your children, right? And I mean, when you're talking about data and things, you can actually do your own experiment on yourself in terms of rating your mood before and after you use it. Right?
And since you mentioned this, like, one of the effects that it just has on me is that, I mean, I see all these pictures of people and they look so bright and they look so happy and they look so successful. What the hell is wrong with me, right?
And those false comparisons, right? That really is one of the things that we know contributes to that negative impact on mental health from social media use, right? And, we've heard this before, that, people will post the best 10% of their life up on social media. Meanwhile, you're comparing it to 100% of your life, right? And so while that 10% may actually not be as good as your 10%, when you look best 10%, when you look at your whole 100%, including, the worst 10%, it's like, oh.
Okay. But nonetheless, we see this carefully polished, carefully curated version of other people's lives, right? And the effect seems to be, I want whatever that is, I don't have it, right? I don't have the bright smile, I don't have the, the cheerful demeanor and all of these things that I see, or at least I think I see other people possessing, right? Now, like, I know as an adult that, like, I can have that thought, and then I immediately say to myself, well, that's kind of nonsense, right? Because I have this capacity to, critique my own thoughts, right? But if I'm 11 or 12, I don't have that.
Well, you have some of it, but not, the frontal lobes still aren't fully developed at that point, right? And so the frontal lobes, that's the front part of your brain, that's where your ability to make judgments, decision making, personality, lots of that stuff all resides there, right? So for younger teens in particular, that is really problematic, because
Sure.
even though they might intellectually be able to say, yeah, there's a filter, and they know that they can turn themselves from their beautiful little cherub faces to turn it into a monkey or a little poop emoji, you know, depending on their age and their interests.
Yeah.
You know, they know that that's not real. They know that they haven't physically changed their look.
No look.
And so they know how this works, but then to be able to internalize that and to really understand that okay, well, this person here, their teeth aren't actually that white, because I know them in person, and their teeth aren't really that white, right?
Yeah.
And their skin isn't actually that clear. And I've been in their room, and their room actually doesn't really look like that. Like that's just like this itty bitty corner, right? But to be able to then extrapolate from that, to say that, okay, so this is very much a curated, filtered image that they are projecting on social media, and to realize that, yeah, okay, so that I shouldn't take this as gospel truth, right? And so again, those skewed perceptions.
Yeah. Is there a gender difference there?
In what way?
Are the effects of I don't know if there's a word for this effect, but everyone else's lives are brighter than mine. Is this something that affects boys and girls equally, or?
I'm actually not sure. I haven't
Not
looked.
sure.
I
Yeah.
haven't looked at that. Right. I do know. You know, when we're looking at levels of aggression, girls are more likely to kind of use relational things, and so with social media, that can be really problematic. So, for example, if you're trying to, ghost or cut someone else, okay, I'm not going to be your friend anymore, and I now have a new best friend, that person is posting that, and so the person who has been scorned can see that that's happening. The same thing probably happened 30 years ago, but there was no social media. They didn't realize that this person is gone off with the other person, right?
So it's like all my problems are now on TV in a certain sense,
yeah.
right? Everyone's watching me on TV. What's that movie?
The Truman Show.
Truman Show.
Yeah.
It's like the Truman Show, right? Like everyone can see me on TV. Yeah. Everyone knows I'm having this tiff with my boyfriend or my best friend or whatever, right? And of course, the problem there, as far as I can make it out, is that social media offers, whether it's the illusion or the reality, it offers the promise of great intimacy between considerable numbers of people. I can reach out to people across the continent in a certain way, right?
And that's one of the benefits of social media, is that you can increase a sense of belongingness, right?
Yet at the same time, it becomes a forum for people to torture people.
Yep.
Right? And so the question arises, and like in my adult mind, right? Because I don't think like a 13-year-old anymore. I
hope not.
I hope not. My adult mind says stuff like, well, why don't you just turn that damn thing off?
Yeah.
Right?
Yeah.
Yet the child can't turn it off.
And I think this is where parental involvement, particularly for younger, children, for teens, why that supervision is so critically important, right?
Yeah.
And it kind of goes back again to what I was talking about in terms of that individual, because I don't think we can say, okay, all children at 11 shouldn't be using this, or you shouldn't have social media until you're 13 or whatever, because again, kids develop differently, right? I remember seeing this great sign somewhere. And it's like, popcorn kernels don't all pop at the same time. So why do we expect kids to?
Okay.
Do you know what I mean?
All right.
And so because children develop at different rates and different paces, it's really up to the parent. You know your child best in terms of what they're capable of, monitoring that, okay, as they're engaging with technology, what are you seeing? What changes are you noticing, right? Are they happy? Are things going well? Or you're noticing that whenever they get off that game, actually they're snappy, they're rolling their eyes more, they're having a harder time sleeping. Maybe then it's time, okay, we got to cut the screens back or eliminate it, right?
Yeah.
It was interesting. My oldest is actually going to Corner Brook Intermediate next year, and so I was at the parent orientation session. Yeah. And the school had said that they got rid of their X account, their social media, because they noticed they could not stay on top of all the negative comments that were coming through.
Sure.
And they said, modeling, part of it was just practically speaking, but also in terms of modeling that
Yeah.
for their students to say, you know what,
Yeah.
this wasn't good for us as a school, this wasn't good for us as an institution, because there were lies that were being said about us, our school, and what was happening here, and we just don't have the resources to stay on top of it, so we got rid of it. We stopped using it. And I think that's brilliant.
Because we have this kind of tool of social communication that in a certain sense it promises paradise, but it can deliver hell. Okay.
Sure.
Right. Okay. To not put too fine a point on it, right? So there's this promise of I can achieve intimacy and friendship with others on a global scale potentially.
Yeah.
And like that's like, wow, right?
Yeah.
Okay. Right. All these minds interacting, right?
Yeah.
And it's going to be fantastic, except when the minds start interacting. All of this negative stuff starts coming out. The question I ask myself, is that duality just part of the medium?
I'm going to say yes.
Yes.
You know, like when I think about that, you know, it kind of goes back to what we were talking about earlier in terms of, you know, there are benefits and also drawbacks of this, right? And so, you know, when people who are, you know, so excited about this, oh, I'm reaching out and going to be able to, yeah, that is a benefit of it, right? And you may be able to connect with people that you wouldn't otherwise. And for individuals who have niche interests or rare conditions or whatever you want to kind of connect with, you know, or maybe it's not rare, but maybe you are in a rural, remote area and it's you know, it might be, you know, there might be a support group for it in the local, you know, in the nearest urban center, but that's like a 7-hour drive away. You're not going to drive for that.
I might be the only kid in my tiny community who has a diagnosis of bipolar or borderline personality or something like this, but here is this medium through which I can meet other people.
Yeah.
And then, okay, like, there's a powerful kind of bonding that can happen.
Absolutely.
That erases some right, of the kind of barriers between rural isolation and, you know, the promise of the big city, even though the big city brings its own anonymity and isolation. But, but here's the situation I'm interested in. That community of bipolar sufferers or whatever it is, right? They're sharing information, but they're also probably sharing a great deal of misinformation.
They can, right?
Yeah.
And again, it really depends. And so that's why, again, it kind of goes back in terms of how are you using social media and what are the aspects of that, right? So is this a moderated group? Is this purely, you know, peer support, self-support? There's no professional involved, right? So when I was, again, you know, it's not specific to this, but when I was back in Halifax, we used to, I used to run a support group for persons with early stage dementia. And it was only persons with early stage dementia there, but I was there kind of moderating that discussion, right? And so because there was a professional there was some supervision there, we made sure, you know, any misinformation got corrected right away. It was able to do that, right? But I know of other cases where there have been peer support groups that have been solely peer support, and you know, you get some individuals who, you know, I don't want to be critical of them. You know, they're very passionate about their condition, about their challenges, their struggles. They're very, you know, strong advocates for their condition and for other people who are living with that. But sometimes, and again, you know, particularly when we're talking about mental illness, that can skew how, I mean, that's the whole thing, right? That it can skew your understanding.
It can be skewed,
Exactly. And so as a result, that misinformation can get spread, and, you know, it's this a whole snowball effect, right? And so something that started out with very good intentions, great idea, turns out to be something that can actually harm somebody.
Right, because if you are in, I assume, if you are out in, I don't know, Lark Harbor or something, or further out, right, and you can't access medical care as easily as others.
Yep.
You are going to do one of two things, it seems to me. You're going to go to the, to the forums, the chat groups or whatever, to get advice from other sufferers, or you're going to use the internet to self-diagnose.
Well, and again, I mean, that is a problem with WebMD, right?
Yeah,
And I mean, this
yeah.
is one of the, things I often tell people. Stop Googling your symptoms,
Yeah.
please.
Please.
So
Yeah.
listeners,
Yeah.
don't Google.
Yeah.
Talk to an actual healthcare provider. In Newfoundland and Labrador, 811. Do you know if there's no one local? Most places have phone service. You can call
Yeah.
811.
Yeah.
Speak
Yeah.
to a registered nurse about your symptoms, about your challenges. Get some actual, evidence-based information, right?
How pervasive do you think the problem of self-diagnosis is, and what are the worst perils of it?
I honestly, I don't know, because again, there's a difference when we say self-diagnosis, because we have people who say, oh, that's just my OCD showing out, coming out because they like things to be organized in a certain way. They aren't actually diagnosing themselves as OCD,
Sure.
but they're just using this. Now, that's quite stigmatizing language, and for those of you who aren't aware, if you are somebody who does that, I would encourage you to stop saying that, because it's very dismissive and inappropriate for somebody who actually does have that condition. Right? So, there's kind of that kind of not true self-diagnosis. Do you know what I mean?
Yeah. So,
but then we have other people
it's
who are coming in.
self-labeling.
Yeah,
Right?
it's more of a self-labeling.
Yeah.
I like that term. So we have this self-labeling, but then we have other people who are self-diagnosing, where they're kind of Googling their symptoms and, I have this, and then kind of perpetuating it, right? And the other challenge too, in terms of looking at, somebody who, especially when we're looking at, the paucity of mental health professionals, you go to see somebody who, maybe this is the only person you have, right? But there are some counseling programs that, when we look at counseling, that's about mental health. That's not about mental illness. So there's some counseling programs that don't actually train on mental illness. You're not trained on the DSM, right? And so if that's the case, if you're seeing a counselor, well, this actually, it seems like you might have this, maybe you should go get explored. But then the client who's struggling takes that as, oh, I've been diagnosed with this, right? And that's not necessarily what was meant or whatever. But
by the way, I've been told by people in the know about these things that, like, the DSM is nothing but a rough guide. Like, you have to know and understand how to apply it.
Absolutely.
Right?
Yeah.
Right?
And that's one of the challenges, is that, it is a book. Anybody, either one of you could go on Amazon right now and purchase it. Do you know what I mean? Or go to a bookstore and purchase it.
What's it on, 5?
We're 5TR.
5TR, okay.
And text revision for those.
Yeah, okay.
Anybody can go to that, and they go read the, I got this. But again, if you, it's this thick. Okay, so for those of you listening, it's like 2.5, 3 inches thick. This book is, right? It's not an easy sit down, read it in an afternoon, right? It's quite detailed. But one of the things that it says at the very beginning of it is that this book is not meant to be used. Is only meant to be used by individuals with the appropriate training and education to know what this stuff actually means.
Yeah, because there's an art to applying it.
Exactly.
Yeah. And so...
to go along with the science.
Yeah. So, I'll just move on to... you've already kind of brought up stigmatization. Right? And one of the things I notice about social media especially is the way the language of mental disorder, of mental health illness, becomes saturated with, moralistic assumptions, political assumptions, and so on and so forth. So I'll give you an example. Okay, Trump is a psychotic. Okay, now, or Trump is this, or he has dementia or whatever, right? And this is where I first started thinking about this, right? Because all kinds of physicians come out and they say something like, well, if we watch videos of the guy, watch his speeches, he is showing symptoms consistent with this, that, or the other thing, right? But and I know it says this in the I think it says this in the DSM, any conclusive diagnosis depends on an interview, right?
Yep.
But of course, in the news media, that distinction gets totally lost, right? And so you get the story, well, 300 doctors say Trump has whatever he has, okay? Without the qualification that what we're really saying is that he's shown symptoms consistent with, right? But that's not a diagnosis.
No.
Except in the public mind, that's immediately translated into a diagnosis. And then you get, well, you know, Trump is a psychotic. Trump supporters maybe are psychotics too. The problem with society is psychotics, right? It's our fault, right? I have a slip of paper somewhere that says I'm a psychotic.
Okay.
Yeah. I'm fine, right?
I haven't assessed you, so I'm not going to.
Very responsible move.
But
I think this kind of goes back to what you were saying, though, right? And in terms
I'm
of
not responsible for Trump.
Right?
nothing,
No, you're
nothing,
not responsible
nothing
for Trump.
about that illness as I experienced it has anything to do with conspiracy theories or political delusions or all of this.
And
right?
again, I think it's really clear that, you know, when you're looking at that, and it's not, yes, it's an interview, but it's multiple aspects.
Yeah.
Do you know what I mean? Like, if you are doing a true diagnostic assessment, you're not just using one piece of information.
Sure.
It's not just a questionnaire. It's not just an interview. It's not just a collateral, like an interview with a close family member or friend or whatever. Like, it's multiple pieces of information that you're taking in, right? In terms of looking at the history and all of that stuff, right? There's so much more. Plus the fact of, you know, and also, you know, when it comes to mental illness, in terms of looking at physical health as well, right? So, for example, you know, somebody who has a thyroid disorder, for example, you know, that can affect your mood, right? Significantly. So it might not be that you have depression. It could be that you need your thyroid checked. Do you know what I mean? And to get some assistance with that. And once we get your thyroid levels back to normal, boom, all of a sudden your mood issues is gone. If that's not mental illness, that's you have thyroid. Now, some people would say, oh, well, that means you actually had a mood disorder due to a general medical condition. Yeah, okay. You know, we're starting to split hairs there. Do you know what I mean? But practically speaking, as long as we keep your thyroid in check, your mood is okay.
But there is this heightened, like, you know, like, just jumping off of both of you guys' points, like this colloquial use of psychological terms is actually really kind of terrible, and I never realized how stigmatizing it is to be.
Because they function as markers of political or sexual or religious otherness, right? So, I mean, I use the language of mental health, right, if I'm on social media, and I'm what seems to be, to me, to be a typical person there, I am using those clinical categories: psychotic, schizophrenic, bipolar, narcissistic, that's a big one, psychopath, sociopath. I'm using all of these as part and parcel of a moral, a social, or a political discourse, right?
Like a judgment.
Yeah, right? And it's like, well, I guess you haven't read Foucault, right? I mean, and like the baleful history of how mental health categories have been used to manipulate and control and dominate other people, right? And, you know, don't need to want to go into that there, but like that kind of saturation of mental health language with moral judgment and political judgment and religious or social or sexual judgment, right? It seems like
so whenever you add judgment, that's a problem. Do you know what I mean?
Yeah.
Like whenever that there, and I think, and I'm glad that you're kind of recognizing that. Do you know what I mean? In the sense that this is not okay. And one of the things I want to, if I can't go off on a bit of a tangent and come back to this here, I just want to clarify too the distinction between mental health versus mental illness, right? Everybody has mental health, right? We have good mental health days, we have bad mental health days, right? Like that's everybody. Not everybody has mental illness, right? Mental illness, that's when we're talking about true diagnosable conditions, right? That need, you know, or warrant intervention. So I just kind of want to make sure that, you know, when I say mental health versus mental illness, that kind of everybody understands that distinction there, right? Because again, you know, when we're looking at as a society, you know, people will often use these words, mental health, and, you know, I have a mental health condition. That's, well, okay, we all can have mental health conditions, but do you actually have mental illness? Like, is this something that you require treatment for, that you need accommodations for? Those types of things, right? So often, as a society, we have really, kind of like you were saying, people have started to really pull these languages and these labels, these words into lay language. And, so when I say, somebody is depressed, that usually means something very different than, a student who comes from and says, yeah, I think I'm depressed.
Yeah.
Right?
Okay.
Most of the time, I wouldn't, and I can say this from my own clinical practice here. Most of the students, yeah, I think I'm depressed. Like, no, you're not depressed. You're definitely, your mood is down, but you do not have a mood
condition.
disorder, right?
Okay.
This is not mental illness. What's going on is that your life has just went boom, like you've just failed a test, and all of a sudden you found out that you're not getting the student loan that you want, so your finances are things, and you just broke up with your partner, and you and your best friend are on the outs because they think that maybe that's why you broke up with your partner, because there was something going on there. I don't know. You know what I mean? So you got like a lot of stuff are happening. So as a result, you are experiencing sadness. You are experiencing worry or fear. These are normal human emotions, right? People have emotions. That's part of the normal human experience. But there has been this pathologization of normal emotions, so that people think if I'm feeling sad or if I'm feeling anxious, that means I have a disorder and I need to be accommodated. People come in, and we actually get this here, down at ACES, the Accessibility Center for Educational Support, where, they go to their physician and say, I'm really nervous about doing this test. I'm really nervous, about giving a presentation. And they go, okay, and they chat with them. And, in fairness to the physicians, they don't have a lot of time. And so, like, yep, you're reporting all the symptoms. Okay, has test anxiety, presentation anxiety, right along, give them extra time or whatever. But that's not a mental illness. That's not a condition that needs accommodation. Are you experiencing anxiety because you're doing a test? Yeah, I'm not saying that you're not feeling anxious. Most people who write tests do feel some level of anxiety, right? And that's the emotion.
Okay. But on the illness part, now, one of the things I notice is that if I say a word like schizophrenia or psychosis or even a word like psychopathy, in the public mind, what that means is the very worst manifestations of those conditions.
Could be, yeah.
Right? So if I say to you the word psychotic, you think violent. Well, not you, but right, okay, but a layperson.
Could be.
Yeah.
Right. I actually don't know. I haven't looked at the literature in terms of how lay people in terms of what for the impressions of these words.
If when I'm looking at Donald Trump or listening to a Donald Trump supporter, psychotic is the word that comes into my mind.
Okay.
Right. It's because that word evokes for me somebody who presents some kind of, direct or indirect menace of some kind to either to democracy. This person's a threat to democracy, right? Or this person's possibly a threat to me, right? Because the guy who cut the fellow's head off in the bus, what was his name?
Oh wow, I forgot. Yeah.
Vincent Lamb or Vincent Lim or what?
You mean on the Greyhound?
Yeah. So there's thousands and thousands and thousands of people out there who may share a label with that guy, right? But they're not cutting people's heads off on buses, and they're never going to be cutting people's heads off on buses, right? So when you see one thing I would be interested in, I don't know if there's any research on this topic at all, but when you have a high-profile incident like that, right, of a person who has a label of schizophrenia or psychosis or whatever that label is.
You mean what that diagnosis is?
Yeah. When there's a high-profile incident like that, where somebody just, it turns deadly, right? The person acts out, some kind of horrific violence, right? Does that change people's perceptions in a measurable way? Does it change discourse in a measurable way?
I don't know. I haven't looked at that literature, right? So I really can't comment on that, right? I'm not sure.
But I suspect it does, right?
Well, it certainly. I'm not going. I can certainly
Yeah.
see why you would say it's suspected does, and makes
Yeah.
sense.
Yeah.
But there's lots of things that make sense that aren't necessarily true.
True. Okay.
Right?
All right. Okay.
So,
Okay.
So,
Yeah.
so trying to kind of keep things in terms of looking at what we know from the evidence, what we know to be true, right?
Mm-hmm.
But again, there is absolutely, it's we can understand why somebody might be concerned, and when we're looking at an incident of an individual with a disorder who engages in a certain behavior, but is that behavior because they have that condition, or maybe they'd still do that behavior even if they didn't have that condition? Do you know what I mean?
Yeah.
So it's really hard to say what people take from that, how they interpret that, how that changes their perceptions of individuals.
Well, I mean, I think the idea is that, well, somebody hears the voice of God or their dog or somebody telling them to do this violent thing, right? And I think that's when mental health is associated with the fear or potential for violence.
Mental illness, you mean?
Mental illness, right? I think that's what people are thinking of, like
And I think
my dog told me to kill these women, or.
And this is a real challenge. Do you know what I mean? In terms of people who really have making assumptions about mental illness, that they're dangerous, that they're violent. I know even when I don't know if I should say this or not, but
Go ahead.
But when I came here, the office that I'm in right now, that they were renovating the area that's now Counselling and Psychological Services, and so they're talking about putting in panic buttons, and I was like, okay, and I'm like, but why? Like, I'm in a university counseling center. Why would I need a panic button? Like that type of thinking, and this is great, and it was being said, this is an awesome thing. We're being very progressive, and but it's like,
here's your panic button.
But it's like, but I don't need that. Like, that's not. I'm not on a locked unit with severely ill individuals who are engaging, who are known to engage in unsafe behaviors.
Yeah.
I'm in a university counseling center.
Right. Okay.
Do you know, folks, seriously, like, what do you think? Like, no, yes, people will come in, and yes, I have had individuals who are quite ill. Do you know what I mean?
Yeah.
Like I said, it's been almost a decade here, and I've seen individuals with personality disorders. I've seen folks with bipolar. I've seen folks with schizophrenia. I've seen a wide range. The vast majority of people I see have low mood and high anxiety, right? Regardless of whether or not they actually have a mental illness, but they're experiencing depressed mood and increased anxiety that is of sufficient concern to them that it warrants some intervention. Right?
Yeah.
And so, when we look at, counseling, our history, I mean, I don't have the most recent data because of the whole cyber attack thing and blah, 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 blah. But, historically, on average, students see us for 4 sessions, right? And they get what they need. You come in, I'm struggling with this. Okay, let's give you some skills. Let's talk about this, move on from that. And I realize we're kind of moving away from the whole social media aspect here. But it kind of comes back to it. And so some of that is, okay, so you're feeling really depressed and da-da-da. Well, how much time are you spending on social media? How much time are you engaging in this? What are you doing? And so this is one of the things that we'll often get people to do. Now, part of this is because I, traditionally work from a cognitive behavioral perspective. But it's like, how does your mood fluctuate when you're doing different things? And so if you notice that, whenever I go online and I'm scrolling through Snapchat and I'm a chat, or TikTok or whatever it is, and afterwards I feel worse. Like my, in terms of my depression levels are higher, my anxiety is higher.
I think we've all had that experience of walking away from Twitter and going, why the hell did I just spend a half an hour there, right?
Exactly, and feeling horrible about yourself. It's like, okay, well then maybe that means you shouldn't be doing that. Do you know what I mean? And if you need to get on that social media platform because, there are, like I know there's some groups that I volunteer with, and that's how they share their schedules through social media. Or so you go in, you log in, you look at your schedules, and you get off the app.
Right. And well, I mean, for someone like me, it's a medium of contact with other scholars and sharing of research. And if I publish an article, I can put a link there, right? And all that's kind of essential. But at the same time, you constantly asking yourself, "Holy cow, is this worth it?"
Yeah.
Right?
And that's really the key question. Is
Yeah.
it worth it? For some people, yes.
Yeah.
For other people, no. I mean, these platforms, social media has been designed to be addictive, right?
Mhm.
And I mean, one thing, it's
Yeah.
It's that whole dopamine hit
Yeah,
that
the
we
dopamine
get
with the
when,
like,
with
yeah.
the likes and
Yeah.
all that stuff, right? It's being rewarded.
It's very cunningly designed.
Right, it is, right? And so, you're kind of going and you're getting this connection with some people, but then you also get this, random reinforcement, which increases the likelihood that you're going to go back. It's the same thing as gambling on a slot machine,
Yep.
right?
Yep.
If there was
Yep.
never any chance of you winning, it'd be
Right.
really easy to
Easy to
quit.
quit.
But because it's that random, you don't know when,
Yeah.
could be the next button, could be the next button, I can get the big win.
Right, I can get the big right.
Right, you
And so
keep going back.
that explains why people are addicted to something, addicted to an activity from which they derive hardly any pleasure, right?
Yeah, exactly.
Yeah, right.
Yeah, that's
Yep.
the science behind it.
That's the science behind it. I will make you spend 2 hours a day doing something you hate.
Well, something like 90% of smokers say, like, "Oh, just
I don't enjoy
I would do
cigarettes.
anything if I could quit."
Yeah.
this."
Yeah.
So
Yeah.
it's like an incredible,
Yeah.
like analogy with the
Yeah.
addiction aspect of it.
And that like sometimes if I smoke a cigarette in a bar or something, right? Or not in a bar, outside a bar now, but right, it's like, why did I ever do this?
Or like a flame war on social media, like a Twitter
Yeah.
battle. Like, what was I doing?
Why do I waste my time doing this?
So what is it that like heightens our emotional relation to, like, it's like, oh, like I have to have this argument now, like it's so curious to me how we have this almost like physiological response to something in our hands, like most of the time,
Yeah.
like,
I sometimes feel obligated to respond to people.
And
I
so
think-
again, that's very individual,
Yeah.
right?
Yeah.
So that will depend on your personality,
Mhm.
the topic, how important it is to you, whether or not, it's, and I it's kind of like, what's the point, right? And so for some people, it's, it's very clear, like, yeah, I'm not touching that with a 10-foot pole. And there are things that I've seen online, it's just like, that is factually inaccurate, but I
But
know
no.
that even though I could go on and I could correct it and say, I'm going to get into this back and forth, and I'm just wasting my time. Do you know
Yeah.
what I mean? And so,
Yeah.
what's the point, right? This is not anybody that I know. This is a random person out in social media land, who, like, I can't control what everybody says, right? I do my part in terms of trying to educate, trying to speak. That's why I'm happy to be here
think
today.
Part of the problem, if you're a scholar, say, is like that this is kind of the town square now. This is the parliament, as it were, through which society debates and has exchanges on important issues. Shouldn't I be there trying to elevate the conversation somewhat? And like, that's a trap, because you'll never elevate that, right? Right.
It goes to the lowest common
It
denominator.
goes to the lowest common denominator always wins out.
Usually.
Right. Yeah. But
I mean, are there cases when, yes, somebody's posted something like, actually, like, oh, okay,
Okay, I didn't know that,
and
yeah.
there has been, right? Normally that's with somebody who I know, or they know me. Oh, do you know what I mean? It's like,
because one of the other peculiar things I've noticed is if it's like on X, if a random person is commenting and I don't know them, I don't trust them. My assumption is they're lying to me, right? Or they're working for the enemy. They're working for the Chinese. There's whoever they're working for, right? They're working for the woke mob. They're right, So along with the intimacy comes the intimate presence of potential enemies, right? Like, I'm out there and all the people seeing my posts, some of them could be that kind of person over there, right? And if I don't know them, and if they say something that bothers me or seems contentious to me, my immediate assumption is, well, that must be, that guy must work for Carl Schwab or, whatever, right? You ever talk to conspiracy theorists? Don't. I, for various reasons, have, but don't talk to those people.
fair enough.
Right? Because it spirals downward and downward and downward and downward and downward. Right?
And so again, like sometimes, and again, it really depends. And so one of the things, one of the skills when I'm talking about communication, right, is I talk about the goals of communication, right? And any type of form of communication, they will always have at least one of these three goals.
Yep.
Either to meet an objective, so you want
Mhm.
something to change as a result of this communication, an impact on the relationship, so you want to influence how that person feels about you,
Mhm.
right? Or self-esteem, self-worth,
okay,
right?
yeah.
So, for example, I know you say, okay,
Yeah.
you don't want to get engaged with conspiracy theorists, but, like, if you have people out there who are spouting misinformation or who are, spouting hate speech of some variation or whatever.
Mhm.
For some individuals, they have to speak up because they said, I won't feel good about myself if I don't.
Yeah.
Right?
Yeah.
And so, but there are guidelines around how you can do that in a way, so that it is a successful or maximizes the chance.
Mhm.
Now, the person's probably not going to change their mind. Do you know
No.
what I mean? Right?
No.
And you probably aren't going to be BFFs with this person afterwards because, the reason you are choosing to speak is because you feel very passionately, very
Yeah.
deeply about
I feel
this.
I have a kind of public obligation to speak this way in this very public forum, which
Exactly.
is kind of like a speaker's corner.
Exactly,
Right.
exactly,
Yeah.
right? And so there are ways that you can do that in terms of saying your piece and then moving on, right? And so sometimes, that's what you have to do. When you're looking at social media, though, when you have the keyboard warriors who are, anonymous and masked and, they're able to say and do things. I mean, when you think about years ago, the only way to say something mean to somebody was to say it to their face.
Yeah.
And then, you might end up with a bloody nose or a black eye
Yeah,
or whatever because,
yeah.
it's not that I'm condoning violence or saying that was okay.
Or if you're an
but
author, you can
kids-
trash them in a book, but most people.
no, but I mean, like, no, when you're
Yeah.
thinking about,
Yeah.
young children, early teens or whatever, they got, they're going through puberty, the hormones are flying, their frontal lobes aren't fully developed, so they're not able to really think through the consequences. Well, if I punch Johnny in the nose, then what is this going to mean? And blah, 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 blah. But that's what it was. Versus nowadays, you can get on and you can say whatever you want, and no one knows it's
And
actually
frequently
you.
there's this mask of anonymity there, which I take it there's some debate about this, but is the mask of anonymity one under which we can release our most aggressive and
Limbic kind of.
yeah,
Yeah.
tendencies, reptilian brain? I get right, and I don't know, right?
But I mean, here's the thing. I mean, we have, as adults, now, granted, in the literature, this debate, is it, 25, is it 30, is it 21,
Okay,
somewhere, when do your frontal lobes, when are they fully developed? But I mean, we're all adults here in this room, and I'm assuming most of your listeners are adults as well, right? And, even if you are looking at, the university student population, they're early 20s. There's most of, even if there is a bit of development still left to do, most of it's done. Like you can fully understand and appreciate, the consequences of your actions, or 90% at least appreciate the consequences, So it's about, trying to make sure that we have a responsibility, do you know what I mean, as fully functioning adults to be respectful and polite and otherwise society is just going to go to chaos.
Chaos, right?
Right?
So how are we for time, Jordan?
We got another 5, 10, I guess.
Okay, so
can just
I have
go
my
with that.
last question here. As a therapist or as a parent, answer this question under both headings or either heading as you like. Parents out there, if you're wondering, what is do you think is the most important piece of advice you would give? I guess not only parents but teachers or other people who are, involved in the care of kids of a certain age.
Yeah.
What's the one thing you'd want to emphasize?
With respect to social media, really monitor it. Do you know what I mean? And when I say monitor it, I'm not just meaning, in terms of, they only get 15 minutes or an hour or 2 hours of screen time, but what is the impact, right? And have conversations, talk to them about it. Kids are smart. Do you know what I mean? Just because their frontal lobes aren't fully developed yet, that they still have thoughts, they still have perspectives, I mean, especially, when we consider about, we go back the clock 4 years to COVID. That's the only way folks could interact with each other was through technology. Right? And so it was a fantastic thing, right? Particularly for children and teens, where that social network is so critically important. So, you know, for this...
There it served a vital social function.
Extremely vital, right?
Yeah.
However, we're in a different scenario now, right? The pandemic has been... Yes, COVID is still out there, but the pandemic is over. And so, but are we still living like the pandemic is there? Do you know what I mean? Are you still kind of, okay, no, it's better for little Jimmy, little Susie to be in the rooms on their screens, right? Talk to them about it. How do they feel, right? Noticing, okay, this is what I'm noticing when you get off, you know, when you do this is what's happening. Talk to them about what's happening, what are they doing, and really then make the decision that's best for your family. It doesn't matter what your next door neighbors or the folks down the street or whatever are doing, because each family, each person is unique. They're different.
Except in the kid's mind, it does matter because, you know, Susie's mom lets her do this, this, and this. How come you won't let me, right?
Absolutely.
Yeah.
But that's the joy of being a parent. Ideally, as parents, if you are a parent of a teen, your frontal lobe should be fully developed so you can understand, right?
Yeah.
And again, sometimes that's the job of parenting, is not to make our kids be happy all the time and to do whatever they want. It's about making the decision that's best for your child, making the decision that's best for your family. Maybe that means, just like some of the schools have decided, is no social media at all. Maybe it means some social media under very strict controls and monitoring, right? And then go in and checking, you know, and I get it. I got kids too, and it's a pain in the butt to have to kind of go in and gotta go through all the messages, especially when they start going back and forth, and there's lots of them. But we gotta do it. You know, that's our responsibility, right? Kind of have the conversations with kids, see how are they feeling, see how are they using it. You know, are they still going out with their friends? Are they still, you know, riding their bikes and, you know, playing soccer or whatever it is that they like to do, you know, color, you know, draw, paint. There's so many. Please read.
Please read a book, yes.
Yes.
Right.
You know, right. So I think there is no one rule. I think if anything in terms of the takeaway, there is no one size fits all. And I know that is like, oh, fruit, this is brutal, this is hard, how do I do that? I get it. Parenting, it's brutal. But that's the job, right? And there's a lot of joy that comes with that. And some of the conversations, you know, some of the things that your kids might say back, it's really insightful. Like, listen to them, right? Yes, take it with a grain of salt. Their brains are still developing. But that doesn't mean that their perspective, their take should be completely ignored, right?
Okay.
Cool.
I guess we're good then?
Yeah. Thanks so much, Veronica, for illuminating all that stuff and, you know, like breaking open all these interesting questions. So,
thanks so much for having me. I appreciate it.
Appreciate it.
Thank you very much.
This has been Parmenius, guys. Thank you.